Good evening, everybody, and welcome to this webinar where I'm delighted to be talking to Nicole Valens, who's an award-winning, highly experienced clinical hypnotherapist. As you know, I'm Dr Clare Spencer. I'm a menopause specialist and GP, and with my very good friend Helen Normoyle, co-founder of my Menopause Centre. So with Nicole this evening, we're going to be talking about the role that hypnotherapy can play in helping manage symptoms of the menopause. Before I introduce Nicole, just a few points on housekeeping. We are recording this session to view afterwards, and it will be posted up on the website of my Menopause Centre. I'd ask that all those here, please turn your microphones off. And we will take questions if we can at the end of our chat. It is quite difficult to answer specific personal questions, but we can answer as many general questions as we can in the time allowed. So first of all, let me introduce you to Nicole. Nicole was awarded an advanced diploma in psychotherapeutic counselling and hypnotherapy in 2015 when she set up a successful private hypnotherapy practice specialising in treating anxiety and trauma. She has an MA in social work and has been trained in dialectical behavioural therapy and CBT. She has been a mental health professional for 15 years, working with people suffering complex and enduring mental health issues. Nicole's an accredited member of both the National Counselling and Psychotherapy Society and a member of the National Hypnotherapy Society, and she's published several articles on hypnotherapy. Nicole is passionate about the benefits of hypnotherapy and is always keen to research new ways to use hypnotherapy to enhance our well-being. So welcome, Nicole. And just to sort of set the scene, as we know, the menopause is a transition where changing, ultimately decreasing hormones result in symptoms experienced by around, 2 in 10 women may sail through, but we know that 8 in 10 women will have symptoms, usually vasomotor, but can be psychological, physical, and we've mentioned hot flushes and night sweats. And although HRT can help many women, often many women don't want to take HRT. Many women may be advised that HRT is too risky for them, and many women have tried HRT and maybe suffered side effects, or it hasn't quite hit the spot and managed all the symptoms that they want to be managed. And that's why I'm so delighted to be talking to Nicole, as this is where alternative therapies can really have a part to play, and focusing on hypnotherapy this evening. So Nicole, welcome. And I suppose the $92 million question is, what is hypnotherapy?
Hi, Claire, and thank you for your lovely welcome and for inviting me on to your webinar tonight. I'm really delighted to be here. So if I could answer your question, if I may, by saying what hypnotherapy is not, because there's so many myths and misconceptions around hypnotherapy. So hypnotherapy, it's not a magical power. It's not, I can't hypnotize you against your will. You're not under my control. It's not like you see in the movies or films or things where the evil hypnotherapists get you under their control and get you to do things for them. People can't be hypnotized to do things that are bad for them or that goes against their moral code. So what hypnotherapy is a very natural state of being. We get people get into a trance state, which sounds a bit scary, but is a bit of a daydreamy, focused state of concentration. Sort of similar to the state you get in when you're engrossed in a really good book or a film, or a video game, or perhaps when you're in a bit of a boring meeting and your mind is drifting away. Yes. So we're in and out of that sort of trance state all the time. And with hypnotherapy, we can utilize that state to make really significant beneficial changes to the way the brain works. Because when you're in a trance state, your conscious, cognitive sort of thinking part of your brain is dampened down, and your subconscious mind is really open to suggestion. And we can use that with imagery and suggestion and metaphor to make changes in the brain, to retrain the brain for it to think differently, when you're out and about changes the way that you act and react to situations.
Yes, yeah. Wow, it's really fascinating. And so if we then think about many of the symptoms of the menopause, so I hear women all the time talking about poor sleep, anxiety, low mood, loss of motivation, and fatigue also so common. I mean, what symptoms do you think are particularly suitable to be managed by hypnotherapy? Is it possible to sort of talk around that area a little?
Absolutely. And actually, most of those symptoms that you described can be helped to some extent by hypnotherapy. So thank you for doing my job for me.
Yeah.
So I'll kind of try and tackle each of them. So let's start with the ones that are really prominent, the hot flushes and the night sweats that so many women experience in menopause and find distressing. So I've done a lot of research into how hypnotherapy can help that, and research has shown that it's really effective in reducing both the number and the severity of hot flushes and night sweats. So it can really dampen those down quite a lot. In terms of, you mentioned sleep. So if you're suffering from night sweats and hot flushes, that'll affect your sleep. So if we can reduce those, that will have an impact on sleep.
Yeah.
But hypnotherapy is also brilliant for relaxing you, for guiding you into a lovely state of relaxed sleep and helping you sleep longer and stay asleep throughout the night. So it can be really helpful for helping with sleep. Hypnotherapy is great for anything run by the subconscious, so anxiety, self-confidence, low mood, all of that kind of stuff. So we can use hypnotherapy really effectively to reduce anxiety, to reduce stress, to improve self-confidence. And so many women find their self-confidence decreases when they're going through the menopause. People feel more anxious. And we know that stress can exacerbate the symptoms of menopause. So by reducing stress, we can also really help with all the other symptoms of menopause as well. And then thinking sort of a bit further, many women, myself included, put on a lot of weight with menopause. And hypnotherapy can help with promoting healthy eating and giving more motivation to exercise. So it can help in your weight loss sort of journey as well.
Yeah, it's really interesting, isn't it? I mean, I don't know about you, but I talk a lot in my consultations about vicious cycles of symptoms and how it's often really hard to disconnect one symptom from many other symptoms. And I think what I'm hearing is something similar from yourself. You can have knock-on positive effects if you help one little bit.
Yeah, absolutely. So we can tackle one thing and that will have an effect on another. And you know, we're complex people and everything is interconnected. It's hard to kind of separate it out, but we can certainly help with lots of different aspects that women are experiencing, for sure.
Yeah, no, that's good. And so if you think about the appointment itself, what happens? Because obviously there are so many myths, and I'm sure you've heard them all about hypnotherapy and, you know, you swinging clocks, etc. Can you just talk us through what happens during an appointment?
Absolutely. So definitely no swinging clocks. I don't use those. So what I do is I will get somebody nicely comfortable in the chair or laying down, and I will have spoken to them beforehand, so you know it's not a complete stranger. And then I talk you through a guided relaxation, so relaxing all the muscles in your body and getting really calm and relaxed, focusing on your breathing. And then I will use a visualization, so maybe imagine yourself on a lovely beach or walking through a forest or sitting in a lovely garden, and using that visualization to really deepen that state of relaxation. And that takes about 20 minutes. So the first 20 minutes of the session is about deep relaxation. And then once somebody's in that lovely relaxed state, that's when we do the clinical work and use the suggestions to do whatever we're trying to do, reduce the hot flushes or increase confidence or reduce anxiety or promote sleep.
Yes. And so how might you expect to then feel Well, number one, during or then and then after a session with you.
So during, you'll feel really relaxed.
Mm-hmm.
If anyone's done yoga, I often say it's a bit like the shavasana bit at the end of yoga, when you're sort of drifting away in a sort of a half asleep.
Yes.
Some people are aware of every single word I say, they hear everything. Other people kind of drift in and out, a bit of consciousness of what I'm saying, and some people go off in their own little world and come back at the end of the session.
Yeah. Yeah.
When I bring you back round again, people are often surprised at how much time has passed. They say, oh, it felt like I've only been, gone for 5 minutes, and it's been a whole hour. And most people feel very relaxed, very refreshed, and feel good. They enjoy it.
And so you could drive home, for example.
Absolutely. Yeah. It's
Yeah.
just like having a brief nap, and when you wake up, you're feeling refreshed. I always say to people, take a couple of minutes to properly come round, because you've been quite deeply relaxed. But no, there's no adverse effects at all.
Yes. Yeah. Okay. And does it always have to be face to face, or can you do it over a webinar, a screen like we're speaking this evening?
Yeah, no, absolutely. I do all of my work now online,
Mm-hmm.
and it works really well. It does work equally well face to face, but it works very well online. And also, for some things, I've produced audio downloads, so you can actually do self-hypnosis. So you can listen to a pre-recorded download, and for some things that works really well as well.
Yes, and I have to say that Nicole has sent me one of her downloads, and it is amazingly relaxing. Hearing your software, I totally get the benefits. Okay, so can be face to face, but can equally. Are there some things that you would want to manage more face to face than online?
No, everything I do works online,
Yes.
which is face to face. But there's some things that don't work so well with an audio download. The things that are a bit more bespoke,
Yeah.
for example, phobias,
Okay.
particular things that someone wants to work on, that would need to be, a bespoke session. Whereas other things can work with a pre-recorded download session.
Yes. Yeah. Okay. And is hypnotherapy available through the NHS, or is it just available privately?
At the moment, it's just available privately. Unfortunately, the NHS, the NHS have recognised hypnotherapy for IBS, which very recently, which is fantastic, but they haven't yet recognised it for anything else. But we keep on pushing with that.
Yeah.
So no, it does have to be privately, unfortunately.
Yeah. Yes, I was reading the Irritable Bowel National Institute of Clinical Excellence guideline earlier, and was really fascinated to see hypnotherapy is mentioned there in that guideline.
Yeah.
So yes, but okay, but sadly can't access it through the NHS at the moment. Okay. And so what is the cost approximately, and how many sessions would somebody need, say, coming into this with menopause symptoms that they were hoping to help tackle?
Okay, so it depends where you are in the country.
Yeah.
So the cost does vary a bit, but you're probably looking between £50 and £100 per session.
Mm-hmm.
And normally you'd budget for between 4 and 6 sessions of hypnotherapy. But if you wanted like a download, an audio download, that's a much more cost-effective way of doing things. And you can buy those for about £12 to £15 usually.
Okay, so there is a wide variation. And how many sessions then is somebody likely to need?
So everyone responds differently to therapy, of course. But what I normally do with people is I say, we'll look at four to 6 sessions, but we monitor it as we go along. So after each session, we kind of reflect on how things are going and tweak it a bit, and then say, well, okay, you need another couple, or yeah, you seem like you're on top of things and you don't need any more. So it's always sort of tailored and personalized to the clients and to their needs.
Yeah, no, okay. And I know on your website you've written about hypnotherapy, and obviously you've written articles on hypnotherapy. Can you talk a little bit about the evidence surrounding the success of hypnotherapy, and that sort of, and in that, the success rate that women might expect, say, for example, with hot flushes, if they were a particular issue? Yeah.
Yeah, absolutely. So there's a huge body of research out there. So I've written a couple of articles and tried to kind of pull it all in. I think one of my articles has got about 30 references. So there's lots and lots of research. People are looking into it. It's a really strong topic for research. In terms of hypnotherapy, one of a big scientific study has shown that that hypnotherapy is effective in reducing hot flushes by 74%, which is massive. And it says in the study that's sort of equivalent to the results of HRT.
Yes, yeah, it is.
Really, really effective. And the results endure over time. So after a few sessions, the results last. So people don't, it doesn't sort of fade away, or they don't keep needing more and more treatment. So it's once you've had the treatment, it's effective for a long time. Anecdotally, I would say that I don't do research on my own clients, but just judging by the feedback I get, it's around about 80% success rate. So it's very effective for certain things, not for everything, of course, but for certain things, it's really effective.
Yes, no, that's great to hear. And actually, that reminds me that I'd heard from another doctor that breast cancer patients had been able to access some hypnotherapy through the Menopause Centre, which is maggies.org.uk. No, it's maggies.org. We can put the link through, which is really interesting, isn't it? And sort of fits in with that. Yes.
Yeah, no, that's brilliant to hear. Yeah, that's really, really positive.
Yeah. And so you mentioned that there are some symptoms maybe that are more resistant or less, or for which hypnotherapy is less effective. Is it possible to generalize, or does it vary hugely?
Well, it does vary from person to person. Some people are more suggestible, more open to hypnotherapy, or it's more effective for. And hypnotherapy, there are certain things that hypnotherapy doesn't work for. So it cannot work for physical kind of organic. So, if anyone ever tells you use hypnotherapy for cancer, it's not going to work. It works for, as I said before, things that are driven by the subconscious. So mood disorders, thinking styles, habits, pain management, because pain is a subconscious thing. Changing habits and changing the way we think and behave, but not so much the way your body grows or the chemical organic bits of your body.
Yes, yeah. So if somebody was still struggling with low mood and anxiety, and obviously they'd seen their GP, or I know we've spoken before about making sure people are safe.
Yeah,
in terms of mood. Yes, yeah. Is that so? Somebody's on HRT but still having a few symptoms. Is that something that you have managed, that you do manage?
Yeah, definitely, because I mean HRT is a tool and hypnotherapy is another tool, and there's no reason why they can't be mixed and matched. And if the HRT might be working well for certain things, but you're still struggling with other things. And hypnotherapy can reduce stress and anxiety, and that will help in itself with coping with the symptoms. So I would say, I do get a lot of people come to me saying, well, I've seen the GP and I've done certain therapies and nothing's worked, so I'm scraping the barrel and I'm coming to hypnotherapy, which is very flattering. But it can work really, really well. It really can.
Yeah, and I should have introduced Emma Lambourne, who's in our marketing team, who's on the call with us, setting it all up in the background today. But Emma asked a really interesting question earlier about whether whether you put hypnotherapy taught you to put yourself into a trance, or whether you put somebody into a trance, which I thought was a really interesting way of thinking about it. Would you like to comment? It's a really good question, Emma.
It was a brilliant question, and
Yeah.
it made me kind of think.
Yeah.
So when I'm working with somebody, it's always collaborative. I'm not doing to my client, we're working together. Although it might feel like somebody's being hypnotized, you have to want to be hypnotized, and you have to agree to it, and allow yourself to relax into it. So it is very much collaborative, and all of the suggestions that I give to my clients come from them. So in the assessment part, I ask them, I work in a very solution focused way. So I say, okay, this is where you are now, and where do you want to get to? And then we work out what their goals are. And then all of my suggestions are based around their goals, and preferably using their words, because that's much more powerful. So if somebody says to me, I want to feel like I'm floating on a cloud every time I walk down the street, that is what I will tell them they will feel.
Yeah.
So that, because their words are more powerful. So it's very collaborative.
Yes, no, that's really interesting. And I suppose just to round off, I mean, is it possible to talk through a case or a typical case? I know every single person is different, but sort of somebody coming with you, is it possible to sort of give an example of a story you may hear and an outcome that you may then see after a certain number of sessions with you?
Yeah, so I'll speak in general terms.
Yes, completely generally. Yes, yeah.
But absolutely. So somebody who was suffering with hot flushes and night sweats, and also anxiety and brain fog as well. So we talked through what her issues were and how she wanted to feel. And then I did some hypnotherapy with her when we're treating hot flushes, we use hypnotherapy using visualizations of being very cool. So being in a cool place, swimming in a mountain lake, or walking through a cold forest. So all visualizations of being cool, and also staying really calm and feeling calm and in control. And then giving suggestions like you have fewer and fewer hot flushes, and you'll feel very calm and in control. I saw her for, I think, 4 sessions for the hot flushes, and she reported that they'd decreased significantly. So she was not troubled anywhere near so much. So far less of them, and far less intense, which did help with her feeling sort of stressed and anxious, because it was happening at work, and it was really sort of affecting her confidence at work. And then we worked a little bit on her self-confidence, on increasing her self-confidence and helping her to feel confident and in control of things, and able to deal with anything that comes along. I always say to people, we can't stop life, but what we can do is feel able to deal with it when it happens. And so she was able to feel much more in control of things, and better about things generally. So
oh, that's wonderful. And brain fog as well, because oh my goodness, brain fog is such an issue. And yeah, at the moment, yes, yeah, I'm seeing lots of women with brain fog. Yeah.
And when you reduce the stress and reduce the anxiety, that really helps to improve your concentration, your ability to concentrate. If you're not worried, am I going to have a hot flush and have to run out of the room any minute, then you can really focus better on what you're doing.
Yeah, no, that's great. Thank you so much. That it just makes you feel calm just listening to what it's all about. We've just got a couple of minutes left, and I'm just looking in the chat now, and somebody's saying, Emma, I'm with you absolutely. Brain fog affecting confidence, especially at work. And as we started at the beginning, talking about that vicious cycle of, if you can maybe help the anxiety or help the sleep or help the confidence, to then know that your brain really is working. I don't know, what would you say?
Yeah, no, absolutely. It's as we said at the beginning, it's all kind of interrelated, isn't it? And I think I mean, one of the things about brain fog sometimes is being able to kind of think, if you can't think of a word, is being able to think around it. And if you're able to stay calm and feel confident that you're able to do that, you don't get flustered, and then you can just deal with it. So
Yeah.
you might forget the words, as I'm forgetting mine now, but you can stay on top of things and not let it really rattle you, and then it's much easier to think straight.
Yes, yeah. Oh, Nicole, thank you so much for your time this evening. I really appreciate being able to talk to you about hypnotherapy, which I have to say I knew nothing about when I
My
when
absolute
I met you.
pleasure.
Yeah, no. So thank you so much, and hopefully this will help many more women just see their way through that menopause transition more positively and helping manage symptoms. So thank you so much, and thank
Thank
you
you very
ever
much for
so
having me.
Yes, yeah. Okay, take care. Thank you for listening, everybody. Lovely to see you all. Bye bye.
Bye bye.